our good friend, he made a really nice paper about this one. But that I hope you want to explain us a little bit more about your insights about this one, because yeah, it's what I try to focus on with this the didactics to get into that neurotherapeutic benefit. But this paper is really comprehended by about all what I tried to say about the waste mechanism, and that it's all happening in the blood-brain barrier. I did not comprehend right now, but it would be nice if you want to tell us a little bit about this one, Joe.
Well, I think you brought up so many important topics and new insights that really weren't covered in this paper. And I think that you explained it quite well. But even the part that we covered here is that the photobiomodulation, because it has effect on the different tissues, allows it to enhance the glymphatic system. And what we're basically saying is, if I can use my little pointer here, if you can see that the light just really has to get to the skull to have this influence on the extracellular matrix within the fluid of the brain. So it doesn't really have to go deep and affect brain tissue, but it does. It just has to go into this area where it can change the water in the intercellular matrix and most of the materials that's in there. That's you've done a great job in explaining many of these things. So the extracellular matrix is here, and then it's also inside there between the cells, and that's another important aspect, because if we do get deeper, we can go in and affect between the cells, and that's the things that you were talking about the synaptogenesis, which is pretty amazing, pretty insightful. So the photobiomodulation will also have an effect on the arterial vessels to make them dilate, the venous tissue, and these meningeal lymph glands, or the meningeal vessels, basically. So these are also stimulated within their muscular wall to open and contract and allow for a kind of a pull of that glymphatic system. So the way we postulate it is the push from the arterial system, an increase in the extracellular space, let's say within the dura mater and things like that, the extracellular space there, and then a pull through the meningeal vessels. So we are, in a sense, doing everything that can optimize the brain's detox system. And as you pointed out, maybe help with synaptogenesis, and also we're probably going to remove that waste, the excitotoxins, the things that can be, the inflammation, and also the proteins that can get bound up. Because it seems to be this cycle, anything that's going to affect this in and out cycle is going to create a lot of bad things, not just toxins that are sitting there, right? So that the environment is going to be different, but it will have an increase in the pressure inside these vessels, and then it backs up inside the brain. And this sort of pressure can wreak havoc on the normal functioning of your brain and these tissues. But that's sort of my insight. Was that helpful?
Yes, very, very much, because here you see it more clear. That's what you with the dura mater, what you try to explain.
Mm-hmm.
That it's in a concussion when it's this pressure that's important. That it's about all the exact pressure on the skull, on the brain, and then all can happen well. That's how I understand.
Well, the thing that's very exciting about photobiomodulation is about changing that pressure in a sense. If we can start
Ah,
this flow process, and one of the things that's exciting is that the proneural devices really were designed for brain, blood, and body. And it appears that these are the most important factors, for this aspect, because the intranasal part right there seems to be one of the main drainage areas into the cervical nuclei, the lymphatic, nodes, cervical nodes. So what's happening is by putting the intranasal in there, you're going to have a positive effect, on the cribriform plate in this area here. It gets right to the nerves and opens that up. It seems that the drainage system, because of that pressure of the brain, let's just talk about that. It's increased pressure of your inside your brain is a space occupying lesion. Remember, there's only so much space inside that brain. So if you have inflammation, that's kind of more puffiness in there, and that can be a problem. And so drainage is so important. So putting a body pad here on the neck, right, in the evening to increase the flow to the brain, putting it here to increase the flow to the brain, and putting the helmet on to increase the flow to the brain is kind of the push. And then in the morning time, you put the light here to drain, put the light here to suck, and you put the light here to kind of move everything through this process. And the other thing is, and how this also relates to a lot of things we talk about, is that putting a body pad, let's say on the shoulder or on the chest or on the abdomen or something, that's going to affect the lymphatic system and the drainage system, because if it's plugged here, but it might be that it's plugged here, and you need movement, and you need the proper vibration, and you need the proper flow to move the detox, to get that waste out of the brain. We need to have it out into the spleen and the intestines and all these other detoxification organs that are so important to us. So it's the body is a continuum, the brain is a continuum. So therapy, should be a continuum. Shouldn't be like a one shot, we're going to treat the eyeball. Well, what if we treat the human?
yeah, that's a fact. And yeah, thank you for explaining, because I think that's valuable knowledge you have to know as a human being to function well. If you act and do that protocol, what you say, yeah, the thymus, all it pumps up. You've got all these nodes, everything. Yeah. Also, yeah, you mentioned the olfactory nerve. Yeah, you can stimulate outside, like it's like, yeah, to get this complete good pressure and everything. And when you're steady like that, then you will have a good life. With that
Well,
protocol, it can happen.
and
So
what we find is that people who are post-COVID, one of the things that happens to them, let's say they get the COVID, they'll have headache, tension in their neck, eye pain, loss of smell, things like that. And that is because of this increased pressure in the head.
overdrive.
And
Yeah.
that seems to be a final common pathway in so many type of acquired brain injuries. So it really doesn't matter if it's trauma or if it's infection or if it's inflammation or what have you. The body has just like a closed loop. It's only one pathway really. There's not a whole other ways that the brain can heal. So I think that this is going to be fundamentally important looking forward for these, what we would like to call acquired brain injuries.
Yes, that's true. It's all the same mechanism that works to get drained out of the waste. And when there's an overdrive of waste into the body, when these cytokines fire up, then you have to get them out and stabilize them to get them in homeostasis. And when that's happening, then you restore your health and your balance and everything to come back. But when it's coming in overdrive, also with low grade chronic inflammations, they build up if it's already a lot into the body, and there comes the cytokine storm on plus, then it becomes really heavy for this system to drains it out. But when you can help out with the photobiomodulation or other pressure techniques in the fascia, then you will enhance a good drainage, and then all symptoms get down and you become happy again.
Right.
Can be easy, but sometimes
It's
you have
just, it's
to
okay
give it
if
your
you know the mechanisms. It can be
yeah,
easy.
exactly.
It's always easy, but not simple. Thank you. Is there any
Not
other
simple.
slides? Any other slides, Kevin?
No, this was the last one.
Thank you for your presentation. You did great as usual.
And thank you for your good explanation, because we all get wiser from Dr. Joe.